Hello and welcome to another live stream of Dr. Barbara Miller's NCLEX review. Today, the topic will be on chronic obstructive pulmonary disease. These are topics that frequently showed up on your State Board of Nursing examination. So, what is chronic obstructive pulmonary disease? This is a disease, a collection of similar lung disease that can be serious. It is persistent and potentially fatal. So, what is COPD? Chronic obstructive disease. It is narrowing or blocking or obstruction of the airway. Okay, so this occurs in patients with emphysema and chronic bronchitis. Those are two characteristics of chronic obstructive pulmonary disease. So, what is the contributing factors for COPD? Smoking. Smoking is a major contributing factor for COPD. Also, it could cause from occupational exposure to dust, chemicals, or pollutions. It also has genetic components like your anti-1 or A1 antitrypsin deficiency. That's the early onset of COPD. So let's go over the characteristics of a COPD patient. If you have emphysema, the characteristics of emphysema, the patient will be emaciated, lost weight, very thin built. They have something called pink puffer, and we're going to get to that. But emphysema affects the alveoli of the lung, that's the air sac, inflamed and cannot inflate or deflate. Okay, inhaled air is stuck in the sac, causing hyperinflation. The diaphragm flattens, that the patient unable to fully exhale, so the patient will start hyperventilate. So a pink puffer comes from the patient's pink skin. Okay, so when we talk about pink puffer, is the skin, the integumentary. You got to look at the patient. The skin turns pink. The patient will hyperventilate. Chronic bronchitis is another characteristic of COPD or chronic obstructive pulmonary disease. So what is that? Chronic bronchitis affects the bronchioles. The bronchioles become damaged. Okay, sputum production, patient not able to inhale, increase in air volume, patient hyperinflates, along with a decrease in their O2 levels and an increase in their carbon dioxide levels. So what are the characteristics of a blue bloater? They gain weight, they have cyanosis. If you look at the skin is blue, okay? So blue bloater is cyanotic, and pink puffer for emphysema is the skin is pink. So what are the clinical manifestations of a COPD patient? They have a decrease in energy. They lack energy, that they're not able to do much because of the difficulty in breathing. Also, they have shortness of breath or dyspnea. They have weight loss if they have emphysema, weight gain if they have chronic bronchitis. They have respiratory acidosis where the CO2 is greater than 45 and the partial arterial oxygen is less than 90. They do have trouble taking deep breaths. They have excessive phlegm or mucus. So these patients, they will cough, dry and productive cough. If you auscultate the lungs, they will have coarse crackles or wheezing. If you look at the shape of their chest, they will have a barrel chest, more so the ones with emphysema. They may cough up blood. If you were to ask what type of breathing would you see in patients with a COPD, is a pursed lip. Pursed lip. So breathing with a tripod will help them. They become cyanotic if they have bronchitis or chronic bronchitis. They are cyanotic. So the risk factors, okay, smoking over a long period of time impacts negatively on patients with a COPD. It could be also environmental pollution, occupation. Say they work in an area where they have lots of chemical or dust. So how do you diagnose a COPD patient? They will do the pulmonary function test. They also will do the chest x-rays to see if there's any infiltration of the lung. They will do arterial blood gases. Remember, when they're doing arterial blood gases, the nurse must remember to do the Allen's test. It determines the strength, okay, of the artery or the flow, the blood flow, the Allen's test. So the arterial blood gas is done to help make the diagnosis. What are some medications that these patients must be placed on? Inhaled bronchodilators such as albuterol and ipratropium. These helps to break up the secretions and help the patient breathe better. Inhaled corticosteroids, okay? Corticosteroids is an anti-inflammatory and it helps to decrease the inflammation of the lung. They also will do antibiotics such as azithromycin. Remember, some antibiotics is very potent, so they will do the trough and peak. The trough is done on the second dose to see the minimum of the medication in the blood, and the peak is done an hour and a half to see how much of the medication in the blood. Okay, so you want to encourage your patients to take their bronchodilators. That's the first line medications. If they're having difficulty breathing, you want to encourage your patients to rinse their mouth to avoid thrush. Also, if they're not breathing effectively, they will place those patients on a portable oxygen. So you want to instruct your patient, if they have portable oxygen, they should not smoke, because that could be combustible and impact negatively and could even cause death on that patient. So the intervention is smoking cessation. Smoking cessation is paramount. Supplemental oxygen. If you were to ask on the State Board of Nursing, any questions arise regarding supplemental oxygen, is no more than 1 to 3 liters. You want to keep the O2 at 88 to 93%. You want to educate your patient to avoid people who are ill or sick, because remember now, they are immunocompromised, okay, and they're at risk for taking, getting more cold, okay? So they should avoid going around sick people, since they have problems or issues breathing. Avoid extreme temperatures, whether it's too cold or whether it's too hot. It should just be in between, not too cold, not too hot, to avoid issues with the lungs. You also want to educate patient about the importance of getting their flu vaccination, the yearly flu vaccination, and also their pneumococcal vaccine every 5 years. You want to also teach them to purse slip breathing, okay? Also, you want to teach them how to breathe from the diaphragm, diaphragmatic breathing. You want to give them high caloric diet with small, frequent meals. That helps them to save their energy, okay, and not getting overburdened with the foods. So remember, COPD treatments is for chronic asthma, acute distress. Patient could go into acute respiratory distress. That's what I meant to say. Nurses must monitor these patients very closely for acute respiratory distress, because they're not able to breathe effectively. Remember, the alveolar, okay, get stuck with lots of secretions, and their bronchioles damage. So they have major issues with their breathing. Okay, so please to go over all this. You want to adjust oxygen carefully in hypoxic patient to keep the levels at 1 to 2 liters nasocannula. Low partial CO2 is the primary drive for breathing for these patients. You also should encourage the COPD patient to check in with their doctors before flying, about flying and about their oxygen. Okay? Thank you for watching. Hope this be beneficial. It's more to come. COPD, normally questions arise on your state board of nursing. So it is so important for you to journal these notes, okay? Because you will face with different forms of questions, whether it's a multiple choice, select all that applies, whether it's a scenario with case studies, you will see chronic obstructive pulmonary disease on your test. Thank you for watching. Please like, share, and subscribe to the channel. Thank you so much. Any questions? Any questions? Please to journal your topics. Let's be mindful that COPD is three criteria: two, not reversible, that of emphysema and chronic bronchitis, but the only one that is reversible is that of asthma. Okay? Asthma is reversible. And thanks to my participants who have joined. And I will see you this evening for another session. Thank you. Any questions? No questions? Okay, so we'll end now. Thanks.